Welcome to the Section 504 training for all instructional staff. My name is Kristen Besaw, and I'm the District Coordinator for Section 504. The objectives for this course are to help you understand the origin and intent of Section 504, know what qualifies a student for Section 504 services and/or accommodations, and know about the process for referring a student to Section 504 and implementing the Section 504 plan. 504 levels the playing field for students with a disability. It prohibits disability-based discrimination by recipients of federal financial assistance, such as public schools and charter schools. Those who meet the definition of an individual with a disability are entitled to receive related aids and services to meet their individual educational needs as adequately as those without a disability. One of the results of the civil rights movement of the 1960s was the creation of the Rehabilitation Act of 1973. This act provided protections and ended societal discrimination against people with disabilities. In 1978, the Code of Federal Regulations created the framework for providing equal access to all students in any program or activity receiving federal financial assistance. The Act continued to change through the years. In 1990, the Americans with Disabilities Act was signed in order to further guarantee that people with disabilities have the same opportunities as everyone else. And then in 2008, Congress further amended the ADA by broadening the definition of impairment and clarifying that impairment should be determined without reference to mitigating measures. So as a result of these laws, districts and schools are required to make reasonable efforts to identify and locate students who may qualify and inform parents of their rights. They are to meet the needs of students with disabilities as adequately as the needs of non-disabled students are met and provide services and accommodations for students with a disability. There are 4 areas represented on the slide that concern providing a free and appropriate public education for students regardless of their disabilities. FAPE is also intended to protect against the segregation or exclusion of students with disabilities. As a district, we must provide a notice of non-discrimination and adopt anti-bullying and harassment policies. We must also implement all Section 504 plans and accommodations as written without alteration or interpretation. No one may deny students accommodations that have been granted under Section 504. And finally, as a district and campus, we must ensure that Section 504 procedures are in place for identifying the child, evaluating the child, and then conducting a 504 meeting that includes individuals with knowledge of the student, the evaluation data, and placement options to determine a plan for needed accommodations to ensure non-discrimination and support student success. People who are eligible for 504 have a physical or mental impairment that substantially limits a major life activity. The impairment decision is an educational determination, and it is not a medical diagnosis for treatment. The question about whether a person's physical or mental impairment has substantially limits a major life activity is made on a case-by-case basis by the 504 committee using data. So you have this person with a physical or mental impairment, or they have a record of an impairment, or is actually regarded at the time as having the impairment. And this is going to include impairments that may be episodic in remission, transitory, or mitigated. And the 504 committee is going to identify that affected area when the condition is active or present. So when we talk about mitigating measures, we're talking about the disability and what it looks like without measures being taken. For example, what does it look like for a student with a hearing impairment when he doesn't have his hearing aids? Or what does it look like for a student who has ADHD and they're not on medicine? That is the point that you will get to when you talk about mitigating measures in the 504 meeting. If an impairment is considered transitory or minor, this is going to be an impairment that's expected to have a duration of 6 months or less. And while this may not require a 504 plan, it's always a good idea in these cases to come together as a committee in order to determine if the student qualifies for 504. And then for the last kind, if an impairment is episodic or in remission, then it's going to be considered substantially limits when it's active. So if the student has cancer and the cancer is in remission, the student would still probably qualify because that disability is based on when the major life activity is active. When you're determining 504 eligibility, the first thing you're going to consider is, does the student have a physical or mental impairment that substantially limits a major life activity? And this is going to include contagious and non-contagious diseases and conditions, such as orthopedic, visual, speech, epilepsy, muscular dystrophy, heart disease, diabetes, emotional illness, dyslexia, attention deficit hyperactivity disorder, tuberculosis, drug addiction. Whether or not the student has a substantially limiting impairment is going to be made on a case-by-case basis. So when you're thinking about the impairment, this is going to include a cosmetic disfigurement, a physiological or psychological disorder or condition, or an anatomical loss that affects one or more body systems. And so those body systems might be neurological, musculoskeletal, respiratory, speech, cardiovascular, reproductive, digestive, lymphatic, skin, endocrine. Those are just a list of some of the systems that could be affected. And then the final question is, does that impairment substantially limit and then affect a major life activity? And the major life activities are walking, bending, speaking, breathing, learning, reading, concentrating, thinking, standing, communicating, lifting, working, caring for oneself, completing manual tasks, seeing, hearing, eating, or sleeping. So as an educator, how can you refer a student for Section 504? If you have a suspicion that the student has a disability that substantially limits a major life activity, then you're going to refer that student to the campus counselor or administrator. And the circumstances under which you may have a suspicion might be things like the student has a chronic medical condition that's not covered by IDEA, or the student has a disability identified in the IDEA but is not eligible for special education and related services because the student does not need specially designed instruction. This would be something like dyslexia. The student qualifies or is eligible for dyslexia but does not need specially designed instruction, so that student would be covered under the Section 504. Other circumstances include students with low vision, poor hearing, heart disease, diabetes, or other hidden disabilities. And sometimes you may have a family member, such as the parent, who might tell you that they've received an outside evaluation and they are requesting 504 protections and accommodations. And so, again, that is something that you would want to make sure to bring to the attention of your campus counselor and administrator. So, once you made that referral, then the 504 counselor will talk to the parent and gain consent for an evaluation, provide the notice of procedural safeguards. The other thing that might happen is the school might be unsure if the student needs special education. If you are considering that the student may need special education, then a referral through IDEA or the special education department should be initiated. Section 504 evaluations cannot be used to delay or deny a referral for special education. So when an initial 504 evaluation is conducted, there'll be data gathering that happens. That data regarding the student's health, behavior, and academics will be analyzed and talked about. The student will be observed, will get input from the family, and then decisions will be made together as a committee regarding that student's qualification status. And just as a side note, an evaluation does not necessarily mean a test. A variety of sources are going to be used to help us make decisions. And many times for Section 504, an extensive analysis is not required, and neither is a medical or outside evaluation. In fact, if we suggest to a parent that in order to proceed with the 504 evaluation, they're going to need to get outside testing, the district would be responsible for paying for that testing. And so that burden of proof for Section 504 is not as great to require such a request of the parents. So just something to keep in mind for evaluations. During the meeting, you're going to want to have a positive, solution-focused meeting with participants, including the counselor and the administrator who can help make those placement decisions, the student, the parent, teachers, people who are knowledgeable about the student, and those who can interpret the meaning of the evaluation data, like the nurse, a diagnostician, or an LSSP, if other testing had been conducted, your dyslexia specialist, and if the student is an emergent bilingual, the LPAC representative should also be in that meeting. During the meeting, you'll want to be sure to celebrate that student's strengths, get the student's input related to his or her education and the challenges that they face because of the impairment. The parent should also give input related to the impairment and the educational impact that they are seeing. And then you'll also have staff input regarding academics and behavior. As a committee, you're going to answer these 3 questions. Is the student qualified or of an age in which services are provided to non-disabled students? Does the student have a physical or mental impairment? And does the physical or mental impairment substantially limit one or more major life activities without consideration of mitigating measures? Mitigating measures do not include glasses. That is the one exception. So together as a committee, you are going to determine eligibility for that student, again considering the disability, the impairment, and the major life activity. And then you're going to create a plan. This plan is going to be a unique educational blueprint that provides a student access to a free and appropriate public education. The plan should be designed to meet the needs of the individual student as adequately as that of non-disabled peers. And the plan will facilitate the student's opportunities and put supports in place. Overall, the plan should document the disability, evaluate the data, determine eligibility, and then determine the accommodations that will change how the student accesses learning and address areas affected by the disability, including the classroom, during testing, and for behavior. The classroom teacher will then be responsible for sharing concerns if a disability that substantially limits a major life activity is suspected for a student, providing input and documentation to the 504 committee regarding attendance, academics, and behavior, and then attend the 504 meeting when the classroom teacher is notified, acknowledge receipt of the student's accommodations in Frontline as soon as those accommodations are received. When you receive the accommodations, classroom teachers should ask questions if they're unsure about an accommodation or if assistance is going to be needed to implement. Remember that we have to implement the 504 plan as written without interpreting it. So again, ask questions. And then the classroom teacher should also consider how he or she will organize those accommodations so that they can be referenced easily, but then still protect student privacy. Some teachers have notes made on their seating chart. Others have a folder for each student or a folder in which they keep all students' accommodations. Some will keep those on their desktop. But it's worth thinking about as a classroom teacher, how will you not only accept those accommodations and implement them, but then organize it in such a way that you will be able to do that with fidelity and effectively. And then finally, again, implement those classroom and testing accommodations and document that you implemented them. Campus administrators will consult about the plan, ensure that plans are followed with fidelity, and address concerns with staff as needed. They will attend meetings and also initiate meetings for parent concerns, attendance, and manifestation determination reviews. Your counselor, as the Campus 504 coordinator, will distribute student plans and accommodations on the first day of school, help monitor that the plan is implemented, and then schedule and conduct initial meetings, annual meetings, MDRs, etc. And finally, they'll ensure that meetings are properly constituted. So you might be thinking you have 504 students in your class, and you may have other students who have challenges that maybe don't rise to the level where they would need 504 assistance. So what are some things that you can do to help not only your 504 students, but all your students? One thing you can do is make sure that you input grades into TAC every week. So students and parents can be proactive in monitoring late or missing work and whether or not that student might need tutorials or retesting. Another thing you can do is make sure that you're following accommodations in all classes, including the advanced classes. Sometimes that can be a little bit sticky, but accommodations in advanced classes should not substantially change the instruction level, the content, or the performance criteria. You would consider what would be relative in an on-level course, such as extended time, oral administration, presenting in a one-on-one setting if that student might be anxious, and apply those to what could be available in an advanced level course. Another thing to keep in mind is that any optional or extra credit work that you may provide to students, those should also be completed with the same accommodations as required work. Again, that 504 plan is going to apply to all situations and all student work regarding accommodations. And finally, be responsive if a student is experiencing problems. Ask questions, have a staffing. Address bullying and harassment of a disabled student immediately and aggressively. And finally, a reminder about our objectives for this session: to understand the origin and intent of Section 504, know what qualifies a student for Section 504 services and/or accommodations, and know about the process for referring a student to Section 504 and implementing the Section 504 plan. Remember, 504 is the law. It's federally mandated and enforced by the Office of Civil Rights. All campus and district personnel must follow the Section 504 plan, and all staff must exercise due diligence and ask questions when unsure. We want to ensure that all students are successful. For more information, you can access the Parent and Educator Resource Guide, as well as the Section 504 website for the Texas Education Agency. There's a technical assistance manual to assist with Section 504 available on that site. Again, my name is Kristen Besaw. I am the district Section 504 coordinator, and I will look forward to working with you throughout the school year.